Welcome to HYBIZ News. My name is Suresh Kochakar. Today we have with us Dr. Supten Sarbadhikari, a man who should be, and is rightly so, in the forefront of the digital revolution that we are seeing post-COVID-19. An expert in public health and also in health informatics, Dr. Supten wears many hats and presently is an entrepreneur by himself. So my first question, or rather my first request to Dr. Supten would be to introduce himself with this long list of qualifications that have. So I leave the floor open to you, sir, to start the introduction, and then I'll start with a question.
Thank you very much, Suresh. It's really been a long time, and thanks to this pandemic going on, so we are meeting virtually. I have been a medical doctor with a PhD in biomedical engineering from IIT BHU. And then I have been in the academia with the Manipal group at IIT Kharagpur, then with the Amrita group at PSG. And I was the first project director for the Center for Health Informatics with the Ministry of Health and Family Welfare. And we developed the National Health Portal. In fact, you were also involved with it as a steering committee member. So that was really a great experience. And currently I am included in the roster for digital health of the World Health Organization as a global expert for digital health.
Oh, so you are in the right place to be. You are with the WHO, and in this pandemic of COVID-19, I remember we met at so many conferences, we have spoken, we have interacted, but we never knew that day will come when things like telehealth will take a precedence over everything else. And today we are talking of digitization in a big way. We are talking when everybody is locked in. Possibly this scenario didn't even occur in our mind, say, a few months before what is happening now. But where do you think this entire pandemic is leading the healthcare system to? I mean, if I ask you in installments, whether you'll tell me that, you know, this is where we were and this is where we are and this is where we will go. So I will leave the floor open to you for that.
Yeah, I think we have always been talking about disruptions, digital disruptions and so on. I think this COVID-19 pandemic has really brought that disruption without even anyone imagining. So if you remember this telemedicine or telehealth, I mean, this has been going on really for now more than 2 decades in India. But it never really got the push which it suddenly got. So during March, the Ministry of Health and Family Welfare released the Telemedicine Practice Guidelines 2020. And immediately the Ministry of Ayush also followed. So that's a good thing. So something which has been being demanded by the digital health community for a long time, but suddenly this push has come into a show. The other things which are happening because of this COVID, because it's highly contagious. So even treating patients. So a lot of digital interventions, not just telemedicine, but remote patient monitoring, even using of robots, robotics, and tele-home care, all those things are suddenly becoming more realistic. Earlier, they were more in the realm of, okay, maybe advanced countries have it, we don't need it, we can do without it. But now suddenly we realize that we are all in the same world. It's a global village. And unless we embrace digital health right now, actually we are going to suffer more.
Dr. Supten, you were involved in the building of the National Health Portal. And I remember we used to put so many of those health conditions there. We used to tell people what is the chikungunya, what is the measles, what is malaria, and how to kind of, you know, not treat it, but how to detect the symptoms and then suggest various doctors or hospitals where they could reach out to. But nowhere in that was this pandemic called SARS, you know, because this coronavirus is basically an earlier version of the SARS virus that came out. So when you're talking of information overload, today there's an information overload because everybody is at home, they're reading so much about coronavirus and all that. In a WHO pattern that we are talking of, since you are involved in the WHO, there has been a lot of criticism at WHO in terms of how they reacted to this particular pandemic, whether they really thought it was a pandemic or not a pandemic. So what is your take on the entire thing, Doctor?
One of the things which, I mean, we have all been a part of it, I mean, we have been really caught unprepared. Because if you just think over it, for the last few years, we were stressing more and more on non-communicable diseases. We thought that communicable diseases or contagious diseases, we have overcome that. They can't do anything more. And suddenly this one small virus proved that what we were thinking were entirely wrong. And in fact, even now, we don't know enough about this SARS-CoV-2, the novel coronavirus that's causing this COVID-19 pandemic. we are learning every day and learning different ways. In fact, one of the good things which has come out, if you look at the sort of infectivity pattern and particularly the death threat in South Asian countries and even African countries, it's actually far less than in Europe and Americas or the so-called developed countries. So obviously, I mean, whenever we talk of public health or epidemics, there are three factors. One is the agent factor, that is, here it's the virus. Then there's a host factor, and there's an environmental factor. Environmental factor like temperature, humidity, biodiversity, all those things comes. And when we talk about the host factor, how immune we are. So I was actually reading a joke. A coronavirus from the USA is calling to another coronavirus in the Indian subcontinent, and he was shocked to find that he couldn't live up to his reputation. And they said, I mean, they're the sort of immunity they have, because they hardly take anything pure. And that really may not be a great compliment, but somehow or other, I think we are actually doing better, despite the fact that we may not have been so prepared, or even right now, we don't have enough of preparedness which we need.
Yeah. So what we are asking is also, Dr. Supten, in terms of the digitization of the entire process, because today we have literally been forced into a digital world. Actually, maybe as you rightly said, when the telemedicine policy was pending for such a long time, the notification was not done. There was so much of frustration among telemedicine professionals that, look, we have worked on this for so long, but the government of India was sleeping over it, and suddenly a pandemic forced the government of India, the Ministry of Health, to kind of notify the entire thing, and overnight things happen. Which means in India, does these kind of things actually require a push comes to shove, a pandemic actually make things happen?
Yes. And particularly for digital health, as I said, I mean, it's not telemedicine alone. I mean, as I said, connected health, remote patient care, I mean, tele-ICUs and those things, I mean, only few hospitals are doing, but now I think more and more are getting into it. I mean, you can't do without it. So that's become a necessity rather than more of a dream.
Okay. So when you talk of Corona as such, in terms of handling the entire pandemic, looking at from a perspective of where you are, the kind of expertise that people like you bring in, where do you think we will end up finally? I mean, how long will this disease last? Or as Prime Minister Modi said, and many other world leaders have also said, we got to live to learn with this disease. Or will it just disappear like the earlier SARS did? You know, by the time they came out of the vaccine, the disease had disappeared. So will something similar happen this time?
Yeah, there are two parts to it. If we look historically at all the other pandemics, I mean, pandemics happen almost every 100 years. So there's usually a second wave or a third wave, and more or less it continues for almost 18 to 24 months, so 1.5 years to 2 years. And I don't think this would be an exception. So even next year, probably we are going to have some problems. May not be as bad as now because we'll be more prepared. Regarding the vaccine, I mean, personally, I'm not very optimistic because this virus is mutating fast. There are too many strains of it. So even if you make a vaccine against a particular virus strain, or maybe even 2 or 3 strains, there might be other strains, newer ones. So vaccine may not be that effective. In fact, strengthening our immune system would be more effective. And fortunately, again, in the South Asian countries, I think the food habits, the sort of things we take, I mean, whether it's ginger or turmeric and so on, I mean, we have lots of things which we take even without thinking because it's a part of our daily habit, but actually they have got good immunomodulation and immunity strengthening effects. So I think those things are there. Yes, we get used to it. And as I said, fortunately, I mean, here the infectivity is high, but but more people are asymptomatic and the death rates are definitely lower than compared to the developed countries.
If you look at a roadmap from now, I'm asking you to crystal gaze into this. I know we are the kinds who eat pani puris by the roadside, so our immunity levels are pretty good, you know. And whereas you don't see a foreigner or a regular kind of guy really going and having a pani puri because definitely they can't stand it. If you look at the roadmap from now, the kind of infections that we had for a country of 130 crore people plus people, and the kind of death rates that we had, and even with the testing now going at about 85,000 a day on an average, we are not really bad in testing also. The initial acquisition was that our testing was not enough, so that's why our numbers were low. But now even when our testing is going high, if you look at the percentage of infections and even the percentage of deaths, we are still way below the world average in terms of maintaining a very good average actually. So do you think when you look at a forecasting, when you are a public health expert, when you're a digital expert, and you say, yes, maybe a year from now, this particular disease will pan out, but a lot of things, Dr. Supten, you will agree, will not be the same. A lot of things will not be the same. the post-COVID scenario, as everybody is speaking of, after Corona, just like BC and AD, we're going to have now a kind of a AC also. So what does the world of AC look like in terms of the healthcare parameters? Because will you see more crowding in the hospitals? Will you see people in primary health centers going less in numbers? Will you see the outpatient facilities also kind of taking a hit? Dentists, for example, I'm really scared of those guys because their profession is really under threat. What are you going to really see in terms of the medical profession?
No, one of the things which it has, laid bare, and that's globally, that our health systems are not yet prepared enough. So primary health is probably another thing which hopefully the governments will focus more on. The other things which you rightly said, in fact, this disruption has caused maximum effects in health and education, both these sectors. So even before this, schools or colleges didn't look at online learning as a alternative or a viable option. But now they can't do without it because most of the schools and colleges are not going to open before the academic session is over. So all are now going for online tests, and same with healthcare. And healthcare was already moving that way. We are shifting more towards the home care, tele-home care, because if you look at it, hospitals, bigger hospitals, the cost of care is higher and the quality is lower if you do the same thing at home. So that thing earlier, as I said, we were not forced to do so, we were not thinking seriously. But now, once we see that it actually acts, it can do well, we would embrace it. So because the taste of the pudding is in the eating, so that now we are seeing that it actually works. So definitely, even after this pandemic, a lot of those digital things would be adopted. The diffusion is happening, whether we like it or not, but it's happening. So obviously, this tele-home care and those things, health and wellness things, based on the homes and individuals and communities, will probably be more important than going to bigger and bigger hospitals.
But Dr. Supten, I think your phones will now be ringing like crazy because post-COVID, a lot of experts in the digital field, digital health field, who I think, I wouldn't say neglected, but were not heard. People are not willing to hear you. Suddenly you would be getting calls asking, what do we do next? From the healthcare system itself, from hospitals to small clinics to standalone professionals to home care and everybody. Dr. Supten, it was wonderful speaking to you. And I wish, we could go on for some more time. But definitely on another day, we'll pick up a subject which is closer to your heart and we will discuss more on that. Thank you for coming in and speaking to us from Delhi.
Thank you.
And
It's my
thank you
pleasure.
very much. Namaste.